Now, before we actually start scrubbing our patient, I want to show you the proper way that you're going to be doing your sterile scrub. So you are going to have gauze in a container that has chlorhexidine, and you're also going to have gauze that has alcohol in a separate container. These are going to be your sterile containers that for the most part will stay in surgery. So you're going to have those next to you on the side. Your patient is going to be in front of you. When you are sterile scrubbing, the important thing to remember is that you never want your hands to go below your elbows. So when you're doing this kind of motion, we want to make sure we're moving up and down versus using our arms going up and down. So you want to make sure you're bending down and then doing the scrubs that you need to do versus actually bringing your hand down. The reason for that is because if you have any liquid or anything that's contaminated that has drained down your arm, if you turn your arm back down, all of that's going to drip back onto your patient, and you don't want anything to drip onto your patient. You actually want it all to drip away. So when you're grabbing your gauze, you are going to have a dirty hand and a clean hand. Your clean hand will be the hand that will scrub your patient. Your dirty hand will be the hand that grabs the gauze. So right-handed person like myself, I am going to use my left hand as my dirty hand and my right hand as my clean hand. I'm going to feel more comfortable cleaning my patient with my more dominant hand. So my left hand is going to be treated as my dirty hand. So the first step that you're going to do, again, because you never want your hands to bend down, you're going to bend at your knees, and with your dirty hand, you're going to grab your chlorhexidine scrub. You're going to just grab, if you grab more than one, it's not a big deal, but you're just going to grab one chlorhexidine scrub. You're then going to turn towards your patient. When you turn towards your patient, now is when you're going to transfer your gauze from your dirty hand onto your clean hand. You're going to place your hand over the incision site of your patient. You're going to bring your dirty hand over above that, and you are going to drop, not place, but drop the gauze onto your clean hand. Now I can then start my scrub. Once you have completed that, you can turn and drop your gauze into the garbage. But if you miss the garbage, do not worry, somebody else will clean it up. And also remember that you're not putting it in the garbage, you are dropping it in the garbage, okay? Once you have finished your scrub, you are then going to get your alcohol. Make sure you use your dirty hand, bend down, grab your alcohol, turn to your patient, clean hand over the incision site, dirty hand over the top, and drop it, okay? You can then take your alcohol and clean your patient. Once you are finished with that, over the garbage can, drop it into the garbage.